My name is Praveena Gupta. I'm a faculty at University of Texas Medical Branch, Galveston.
Please share with us what you presented at ARVO this year.
Today I'm here to present a poster on dry macular degeneration. My poster comprises of a characterization of Drusen. Drusen is one of the pathological hallmarks for macular degeneration, especially the dry one that can convert to wet eventually. What has happened is, due to the many years, Drusen has been neglected as a main etiology in perspective of treatment modalities. So what I present today is a revisit of Drusen in its microarchitecture and possible shed on the pathophysiology of Drusen.
What were the findings of your research?
So the exciting finding is that Drusen accumulates extracellular on the Bruch's membrane. And there is a disease in kidney that mimics the same etiological process of Drusen accumulation. That's where I'm trying to marry the kidney disease with the macular degeneration etiological disease. This disease, called the dense body deposit in the kidney membranes, is very similar to the deposits on the Bruch's membrane as Drusen. So what I was trying to say is, let's recharacterize Drusen, where it accumulates, how it accumulates, what are the morphological changes, what positive, negative staining it has, and eventually correlate that to a kidney disease. That way, drugs that are applicable to the dense body deposit disease in the kidney can be reapplied or repurposed to the dry AMD disease cure.
In what way do you think this kidney disease and macular degeneration are related?
There is quite a chance that the pathophysiological process of initiation of the Drusen is perhaps related to similar disease in kidney. So we were trying to find out what are the organs deposit similar disease type. And unfortunately, we hit with this disease. There are some publications with relation to this type of dense body deposit disease in kidney. We try to now do a retrospective chart review on patients, where we want to see if patients who underwent transplant, kidney transplant with DDD, dense body deposit disease, do they have the same kind of etiological things in the retina? And I think what we have seen by based publications and what our research is that patients who accumulate the dense body disease in the kidney do have Drusen deposits in the retina. Whether they both have similar characteristic or whether they both have similar morphological formation is yet to be invented.
Is there a treatment for this kidney disease that may also be beneficial for treating Drusen and AMD?
Definitely. That's where we want to take this research to. So we are very closely working with nephrologists and pathologists in UTMB, where we want to apply the similar type of therapy that they are using for this type of disease to the retina AMD. And so it's an immunological therapy, and immunotherapy has been the limelight for many other diseases. And I think there have been some clinical trials that have tried to use the same drug that they have tried to use this type of disease in kidney in the retina, and I think the results are yet to be published. So there's a good chance that we may have to do a permutation combination of different immunogens or antibodies against this type of disease and then reapply in the retina. There could be a good chance.
What are your next steps in this line of research?
Yes, the next step in my research is that once we characterize the Drusen pathological characteristic and the different sizes of formation, its relation to the Bruch's membrane, its relation to the choroid and the RPE cell, when we will treat Drusen thinking that it is an antigen that triggers inflammation, that triggers apoptosis of RPE in the long run. So I think where we want to head is to treat dry AMD with immunotherapies eventually. So that's where our research is heading towards.
Are you preparing for any clinical trials along these lines?
It's a very early phase yet. This thought crossed our mind by looking at various antibody therapy in various diseases like Alzheimer's disease and many lysosomal storage disease and accumulative disease. So I think this can be reapplied towards the treatment of dry macular degeneration too.
Are you working on anything else in your lab that you'd like to share with us?
I think we also are working on another aspect of treatment of macular degeneration is the ocular drug delivery system. Our patients are exposed to multiple injections monthly, intravitreal injections that have their side effects, and these patients come every month or every 3 months to get these injections. So our lab is also working in collaboration with some other folks in the UTMB campus to have an ocular drug delivery system, which will be a novel topical drop that will help in penetrate the cornea and the sclera system into the back of the eye. And we are now working on ocular drug therapy with anti-VEGFs to see if they can permeate the sclera and reach the posterior chamber of the eye, and that will be a good anti-VEGF therapy packaging molecule. So we do have some preliminary studies on that, and we would like to go ahead and publish that very soon.
Where can someone find more information about your research?
Yes, so there is the information on the website where we are in collaboration with 2 inventors. The technique is patented. The molecule is anti-aggregation formulation molecule is patented actually, and it is on the website, and there are many downloads on that. There's a lot of interest in research area on that, and now we are trying to package this anti-aggregation formulation with anti-VEGF to see the penetration on the ocular tissue from the front to back, and then eventually we will use a model to prove anti-angiogenesis of this therapeutic effect.